Hey guys, Logan Richardson, Season 5, Episode 17 of Grey's Anatomy. Here we go.
For a normal person, one of the few things you can count on in life is death.
These are amazing. They're all about the medicine.
Oh,
There's like no personal crap. Don't talk about boyfriends or feelings.
What about when she held the retractor for 6 hours without moving? But if you're a surgeon, even that comfort is taken away from you.
They're like the Harry Potter books I never had.
Did you read the part when she put the pyloric stenosis on the cool baby?
No, you're doing a craniotomy on my patient Rosemary Bullard today now. Are you going to be awake for that, or will you be yawning into a brain?
Meredith kept me up most of the night.
Is it about your dirty...
Talking on the phone with Christina.
Oh, and stole you to sleep. You should know that by now.
Before she had birth, broke out.
True.
The counseling was a good move. Addison and I did counseling.
Right before you got divorced?
Ladies and gentlemen, allow me to introduce
I was about to say that.
Stan can educate you in airway management, trauma assessment, and care. He breathes, he pulsates, he seizes, he hemorrhages, he secretes, and he speaks.
Hello, doctor. I'm not feeling well.
Stan will tell you what he needs, and he's more forgiving than most patients. You kill him, he'll keep coming back for more.
Nice.
Make good use of him, people.
We're operating on robots now? Would please go back to pigs.
What about people?
When the chief decides which one of you gets to do the first solo surgery, you'll want to be ready.
Wait, did you just say something?
The winner should be prepared to do any surgical procedure and will choose one intern to scrub in. So practice your skills.
Oh,
and
that's
attendings,
cool.
And just do not make me look stupid.
You familiarized yourself with the case?
Yeah, Michael Norris, 44-year-old male with congenital hypertrophic cardiomyopathy, who has failed medical treatment at Seattle Press. He's been waiting on a heart transplant since narrowly missing out on one on May 14th of 2000.
Wait. That's Debbie's heart. That's the heart I stole from Debbie.
I need you to have sex with Christina Yang.
Good morning.
Distract her. Engage her. Give her something to do after midnight besides call my girlfriend and wake me up. Single malt scotch, and you're used to beer bongs.
Kelly Torres is no beer bomb.
Oh, you know what?
Go ahead, sure.
Try. How's it feel?
No, not your step horse. Can't just tell me rules.
You slept with my wife.
Yeah, I can just shot.
Are you guys shooting drugs? Oh my god!
No, we're practicing IVs.
How else are we supposed to learn?
They never lets us do anything.
So you're practicing on each other?
We did it at Baylor. It's cool.
That is weird.
Dr. Hunt, got a second?
Male, mid-30s, lost vitals in the field, shock and sinusitis attack. Open right tib fib, rigid apnea.
Dozens.
Found him under a freeway overpass. Cops think someone threw him over.
After they beat him after that?
So it's a contest, solo surgery?
And one more thing. If my ER reports are right, you've been working for 3 days straight. When do you sleep?
You keep tabs on all your attendings or just the new guys?
His IV blues.
Yeah, leave that access now.
Yes, I'm doing it, sir.
Buying some time until you get that one.
Yeah.
So you're gonna...
Through a catheter in your femoral artery, Dr. Han will inject ethanol straight into your heart. The alcohol will incinerate any tissue cells it touches.
Dr. Stevens?
Oh, man.
We're gonna be burning away the muscle in your ventricle that's blocking your ability to get oxygen.
It is a heart attack, right?
It's a dangerous procedure, but it's one that we can monitor and control.
That's so awkward.
The next heart attack you have, and you will have one.
It'll kill me. I don't miss this.
Jeffrey!
What makes latest echo and angio before he goes to the cath lab?
A lot. Is it a lot of Denny for you two? I mean, how much Denny are you experiencing?
My pain
I hate
is
this.
getting
I'm not
worse.
gonna win the solo surgery practicing on plastic, man.
You're not gonna win the solo surgery because you suck.
Your bedside manner is what sucks.
What?
What's the matter? Scared of a little education?
You
are so awesome. You are so awesome. No, stay.
Yeah, 3. Run these to the lab and then go by the morgue and get the forms for an unclaimed body.
He's gonna need a chest tube, right? I was just hoping with the solo surgery coming up.
With the solo surgery coming up, your job is to impress me.
Dr. Yang, with the solo surgery coming up, your job is to impress me. You're planning for this man's death while I'm fighting for his life.
I was trying to be prepared. I'm
Are
sorry.
you sorry? I could use a doctor. B1.
Ooh!
The kind of
Damn, dude!
are prone to spontaneous bleeding. You're signing a do not resuscitate order.
If it's my time to go,
She doesn't want to be on a life support kind of thing. She'd hate that.
I just hate lying around like that.
Oh my
I don't
god!
want that.
It's the guy from Skyrim.
Okay.
I thought I recognized him too. He was in Bones.
Sorry, we do this every time. She signs the paper, kiss goodbye, and then after the surgery, you say hello again.
That sounds like a plan to me. You rest up. We'll be bringing you up soon.
Thank you.
That is the holy grail of marriage.
Something to aspire to.
What happens to them?
Well, if they remain unclaimed for a certain amount of time, they're cremated. The ones that haven't been preserved.
Preserved?
For medical research, gross anatomy, surgical study, that sort of thing.
For like med students
Exactly, for med students.
to practice on?
You're pretty. Hold compressions, we got a rhythm.
We gotta get him up to surgery. He's bleeding through his leg split.
So the chief asked me to watch the second years for the solo surgery. What's your take as class?
They're a mixed bag. Yang's very good.
And Stevens?
She's smart, good with patients, very compassionate. Supposedly. She gets up with my ex-husband while we're still married.
You know what? I'm more interested in the doctor part.
Right.
Yeah,
Obviously.
Of course. There's a splenic subcapsular hematoma.
I can look. Go up the age chart.
Dr. Yang, you paged me?
Got patient trauma 1.
Well, you paged for a consult. I was hoping you wanted to see me.
I did. The patient has a shattered nose and cheekbones and a fractured left mandible. Trauma 1.
He's like. He actually might take this as like a challenge.
Okay, just hold tight. Stevens, over here, please. Mike needs you talking to him. He's scared, his pulse is elevating. Step up.
Hey man, what's going on?
You're doing great.
Hold on, make it. Oh, there it is. Oh, God.
Try not to move.
Try really still. Mike, try to breathe. Can't stop, but it's gonna end soon, so just hang in there.
Oh, good God.
Okay, great. How's his pressure?
85 systolic. Open up his IV.
Stevens, talk to him. Help him.
Does that mean we're not successful?
Please, I can't do this again.
I'm so sorry.
Boy.
Tell Stevens to find me so I can permanently throw her off my service.
Dr. Hama, I know you have a history with this patient, but in a weird way, Izzy does too. No, with Danny Duquette.
Tell her to find me.
That is
Physician's been
just
on.
so
Hey, an
awkward.
ultrasound localization.
And oof.
I took care of my Yang problem, by the way.
Already? That sounds too easy. If it doesn't feel like work, it's not going to work.
Where'd you learn that? Marriage counseling? Tumor's hemorrhaging. Her brain's starting to swell.
I've never
Who's sending the
understood marriage
Writing
counseling.
down, one of atropine. Let's make sure these two get a chance to say hello again.
Dr. Yang. Our guy's scheduled for surgery yet. I want to know when I'm going to see you next.
He's not stable yet.
Oh, well, we might have time.
Let's just put these down.
This has not happened to me.
This does not happen to me.
King of the interns. I've assembled an army of the dead to teach us things.
Hey, do you know know if Izzy Stevens had some sort of a relationship with Denny Duquette? You mean besides the engagement? Oh, and the cutting of his LVAD wires so she could move him up the transplant list? Well, you didn't know about this?
Nearly kicked out of the program.
You didn't know. She doesn't know any of it.
I was at another hospital watching my patient's heart get stolen out of his chest.
Oh, this is going to be
down here for
bad.
Because not really.
This is going to be bad.
Some dead guys.
Why?
For practice.
What?
The solo surgery.
What is this?
I heard you were having a crappy day. I thought this would cheer you up. What?
It's like a bouquet of corpses. That is so.
These are for interns.
Go play with the dummy.
Come on!
I cannot help it. I'm dying. There must be something you're forgetting. I'm surprised you even passed your intern exam.
God.
Wait.
Chief, I have to talk to you.
Hey, hon, come in. I want you to watch this. Let's blow an artery. I'm bleeding out. I'm bleeding out.
It's about Izzy Stevens.
That's hilarious.
How is Stevens still working here? How is Seattle Grace still accredited? This whole thing goes unreported? It's no wonder this place is number 12. What kind of hospital are you
Stop
running?
right there.
I want an ethics review panel assembled. I want Stevens' role in this investigated, and Bailey's as well, because she was her superior.
Slow down, Erica. It didn't go unreported. It was reported to me. I dealt with it. Stevens was punished. She's learned from her mistake, and she's on her way to becoming an excellent surgeon. That's the kind of hospital I'm running.
It is not in the past for me. It's lying on a bed in the ICU about to die.
Then your only responsibility is to make sure that doesn't happen.
I get her being angry. I get it.
It's a difficult surgery, especially at her.
It was in the past.
I'm not sure how she's going to respond.
You're hiding from home? Sure. Or two. Is Mike okay?
No, the ablation failed, and he's refusing to try again. So,
I stole it for Denny. I stole it for myself, and now I'm supposed to hold his hand while we torture him? I can't even look at him. It's my fault that he's here.
Yikes.
So anyway.
Just 1 minute you're working with people, and then you're friends with them, and then you're whatever. So there's all this pressure to define what you are. It's all black and white. Like this, you that.
You are aware that you're doing it again, right?
Dr. Hunt, how's our mystery man? Dr. Yang, cracking chest is more your thing, but you'd be surprised how exciting it can be when I manipulate a little skin.
Actually, Dr. Yang, why don't you just scrub out? We've got enough hands in here.
Hey, I already went up. Can I scrub in?
Oh, shut it. I'm not in. You're not in. You stink.
Showered?
You smell like formaldehyde. Why do you smell like death? Why do you smell like death? I see dead people. Get out. I need off my head case. So in a one-time only offer, I'm going to trade you my beaten-to-a-pulp trauma-palooza patient for no less than 3 of your cadavers.
I need to be with people. Preferably live people. But whatever. Alex, by the way, thank you for bringing me the corpses. That was very sweet.
Dr. Hunt and Dr. Stone are still operating. Do you think I could try?
No.
Hey, check this out. My dead mommy taught me a cool way to hold these instruments.
When your dead mommy teaches you things, see what?
No, I'm reading her journals.
Stop. I was kidding.
I did see her once, though. And that bomb squad guy. And Denny. No, I was dead at the time. I still feel my mom with me sometimes.
I got you. Excuse me.
Could I?
No. Please don't be in there. Please don't be in there. Please don't be in there. Dr. Hunt, I came to apologize and ask if I could please be let off your service. No. If I can convince Mike to have another ablation, you're going to be there to see him through. And if he dies, I want you there for that too, because you're responsible.
He decided. You won't do another procedure. I'm going to go check it out.
Damn.
If you die, she will not get over it. She will not move on. She'll think she can. She'll even think she has. And then, out of the blue, you'll be right there with her so close. She'll think she can touch you. And then all of this will just be happening for her all over again.
Rosie? Rosie?
Damn, that's sad as hell.
Stay with me, Rosie. Rosie, stay with me. Don't leave me, Rosie. Stay with me. Stay with me, Rosie. Stay with me. Come back. Don't leave me. Stay with me. Please, no. Go. Do something for her, man. Do something. No. No.
I hate her.
Please.
I'm glad you decided to try again.
You can thank Dr. Stevens. It's her fault we're here, right?
Vitals are stable. He's ready for the injection.
All right. Alcohol is going in.
Oh, shit.
Oh.
God, that just looks painful. Just.
If he's in SBT, there may be alcohol backing into his AV node. Get him to cough. Look at me, Mike. Look at me.
Jeffrey! Is he ever gonna speak?
He's in V-type, losing consciousness.
Push 100 to flag.
Oh no. Hawkeye's mine. You trade?
Why did you put in a chest tube?
I don't know how.
What do you mean you don't know how? I mean, I'm not that in my first week.
Yes, you learned. You know. But I will never know because you not only won't let me try one, but you hog all our robots and you steal all our corpses.
Is there this much
Yang
blood
is
in this
the
urine
worst.
before?
No. Well, he's going to need a bedside cystogram.
The worst
No, it's
president.
mine. And his bladder repair is mine too.
No, we traded.
Oh, no.
Get away from that man right now.
He was crashing, so he upped his dopamine and gave
That's good. I said step away from him.
I'm just saying that we were saving his life.
No, what you did was pick over him like vultures, like a bunch of children fighting over toys. What you did was treat a man that's fighting to live as if he's already dead. You've no sense, no decency, and no respect.
He's not wrong. He's not wrong.
Rosemary's gone. Her heart is no longer beating on its own.
God, she's so great.
Mike, open your eyes. Just stay here with me. Right now. Right now.
Hell yeah. Damn, that show was really sad.
I've had women opt for needless elective buttock enhancement surgery just for another chance to be flirted with by me. So what's your deal?
I have no idea what you're talking about.
I've been hitting on you all day.
Excuse me.
It was a stupid idea. It wasn't even my idea. It was Shepard's idea.
Ah, come on. That woman is not a single malt scotch, my friend. She is bad, cheap wine that gives you a headache you can feel in your teeth.
They're undisciplined, inarticulate, and they have a lot to learn about respect. Mostly they're more interested in their personal crap than anything else, and I'm not sure that they're being taught anything different. Honestly, I'm not sure we're staying on. Excuse me, sir.
Damn.
They're unclaimed bodies.
Unclaimed. Each one of these people was loved. Each one of these people was somebody. So we are responsible for treating them as such. We claim them and treat them with respect. Close them up, cover them up, and put them back where they belong. Now.
The wife's here at the beating victim. She ID'd her husband, so she wanted to take...
What's his name? I wondered if you asked her husband's name so that he could become a person to you.
Ooh.
They're all people, gang. This is not a game or a contest or competition. See who gets surgery and who doesn't. They're people and we get to save them. Now you're good. You're excellent. You can win all the contests, but if that's why you're doing this, then you shouldn't be. So did you find out his name?
My dad died when I was 9 in a car accident. I was with him in the car. While we waited for the ambulance, I tried to keep his chest closed so he wouldn't bleed so much. When he died, my hands felt his heart stop beating.
Damn.
It's also why I win all the contests. The patient's name is Tom.
Single malt scotch.
We're born, we live, we die. Sometimes not necessarily in that order.
Yes! You don't get to die! Nice job.
Oh, hi. Thanks.
I want to take back what I said before about leaving. I was overreacting. It was personal, and I wondered if you would just forget about it.
Get some sleep, Dr. Hunt. See you tomorrow.
Good save, O'Malley.
Thank you.
We put things to rest.
So I ended my day with a segmental colectomy.
Oh, badass.
Oh, Sloan. Seriously?
What? Oh, did you think we double date?
So if death is not the end, what can we count on anymore?
So, how's your patient doing? Well, he still needs a heart, but I bought him some time. Good, I'm glad. Well, we'll see what he says when I report this to UNIMS. Whoa, wait, why? What good would come of that? What do you mean? What possible good would it do? I mean, would it benefit your patient's outcome? Or...
My patient wouldn't be here if it wasn't for her.
Cost our patients organs, cost people their jobs, cost Izzy Stevens her career.
Wait, so you're taking Izzy Stevens' side in this over mine?
She's a doctor, one of our doctors. There's a reason we have each other's backs there.
Do not talk to me about a code, because this is not that.
No, this is that. But unless you were in the middle of that situation, I don't see how you can make a judgment.
Easy. There's right and there's
Nice,
wrong.
Kelly.
And this was wrong. And illegal. There is no gray area here. You can't kind of think this is okay. You can't kind of side with
it's not
Izzy
okay.
Stevens.
But it's
And
way
you can't
past.
kind of be.
You're just gonna destroy so much more now.
Life is the most fragile, unstable.
You're causing too much.
unpredictable thing there
You're
is.
causing too much more destruction and pain with something that's been over with. Is he gonna speak?
I have to move on. I love you and I will always love you, but I have to move on.
Everybody loves Jeffrey.
Had that patient today and it's...
Go where? Are you okay?
Yes. I am totally okay. I'm fine. Everything's fine.
Are you sure you're okay?
It ain't over.
It ain't over. Ah, Jeffrey. I'm still so salty that I never got that photo op with him. God. So annoying. Love him. He's great. He's in so many things. We've talked about this before. I'm just re-saying what I've already said before, but whatever. He's a great actor. All this stuff going on. Christina is brilliant. She's really good at what she does, but she is so, she's terrible at teaching. She's terrible at doing the things that she needs to be doing, with her interns, and she's very competitive to the point where it's, over competitiveness, and it makes her look terrible. So, and some of the others are kind of like that, but she's the extreme case scenario. So, I mean, Hunt is right in many scenarios. He's also, very harsh, but I mean, he's not as harsh as Han. Han is heartless, honestly. And she wanting to report all this stuff, it's you realize your own career is potentially, you're working there. You're blowing your own... You're blowing your own ship up. You're out in the ocean, and people swim to your ship for help, and then they go along their ways, and you're like, I'm gonna plant a bomb in this ship. The damage is already there, and it's been fixed, and maybe hidden from everyone who comes onto the ship and whatnot. But you found out about the damage, and you want to tell everybody about the damage, causing panic, causing people to leave the ship, and potentially the ship sinks and blows up. It's already happened, it's already there, there's no reason to bring this up again and revisit all of this. Just let it die. Everyone's learned their lesson. Like the video, comment down below, subscribe if you have not already. We are on to Season 5, Episode 8. I will see y'all next time.